Hey everyone, it's Dr. Matt Sherwood with Sherwood Spine and Sports. In this third video of our series on neck pain, we're going to be focusing more on the pain that is caused by arthritis, and that arthritic pain can be pinching a nerve in the neck there. So just like the disc, you'll usually feel these in the same spot. They'll be got shoulder blade area, run down along the shoulder blade, down the arm, 1 or 2 fingers, 3 fingers sometimes. This is usually going to be the older population because as we get older, we get more arthritis. Typically, the pain with this will be worse. So if the pain's on the left side of the shoulder blade, for example, when we look up and when we look toward that side, the pain will tend to get worse. Sometimes with a disc, looking down in a way is actually worse. So it's kind of the opposite. It's very similar to the low back. It's a little bit less consistent with the neck, but I see that quite frequently, that pattern. So the exercise we're going to do here is what happens. I'll grab my model here. Is when we have, there we go, the little yellow nerve there, it sits inside a little canal. So when we get arthritis, that's usually around the joints back here. It can also be on the discovertebral junction, we call it, but usually it's on these joints. And then the bone spurs and accumulated bone will kind of go forward and it narrows that little canal where the nerve is. So instead of having a nice open spot, it'd be very narrow and it's much more likely to pinch. So all of our treatment's going to focus on making more room for that nerve. So when I show you this position we're going to get into, it's going to be a position to really take that little tunnel where the nerve is and open it wide. In the office, as I've said before, almost every video, dry needling works really well for this as well, because if you can needle those real deep muscles that are under spasm, kind of release those, it helps to decompress or take pressure off that nerve, free the joints up a little bit. Adjustments to the neck when appropriate, upper back, ribs are very beneficial for this as well. And then, just the stuff we're doing at home is very important. If the pain's going down the arm, we want to do things to take pressure off that nerve. So the position I'll show you, and then keeping the arm up on top of the head, that'll produce some slack in the nerve, so that'll instantly help any shoulder blade or arm pain as well. When you're driving, make sure the arm's supported on the console or windowsill. When you're sitting, make sure it's resting on an armrest, things like that. So we're just trying to get positions where we feel no pain, because then we know the nerve isn't getting compressed. It'll get more blood flow in there and it'll start the healing process. So next I'll show you this real quick position you can try doing at home if you think you have this issue. All right guys, so for this position, we're gonna call this an opener because we're opening that little tunnel. There's a very similar concept for the low back when you have a pinched nerve that I showed on the table several videos ago. So this is the same concept, we're just doing it for the neck. So what you have to do is you gotta lay on your back. Typically your knees will be bent, so it makes you a little more relaxed. You need to get as many pillows as possible. This probably would not be enough. So if I were at home, I could take a bunch of pillows, doesn't matter where you get them from, bed or couch or something, and I would just start stacking them on top there. But so what we want to do is we want to get the head up as far as we can, so it's propped up, so our chin is to our chest, and then we're going to bend the head and rotate the head away from the side that hurts. So if our pain's on the right side, I'm going to go prop my head all the way up so it's relaxed here. We don't want any contraction of the muscle. So my chin's to my chest, I'm gonna bend a little bit to the left, and then I'm gonna turn slightly to the left. And then what you're gonna do is you're gonna stay in that position relaxed for about 10 minutes. And then that's gonna create more room for the nerve. It's gonna promote blood flow into the nerve, and then the healing can start taking place. If the arm also hurts, typically with your pain, then you can get in that position, and then you can also take the arm, put it over the head like this, put it across the chest. That'll help take some more pressure off the nerve root. So we're just trying to treat the nerve in this situation. If we send you home with this, you come back the second visit, seems like it's better. That's usually an indication that you might have some arthritis causing some narrowing, hitting the nerve. Lots of times when older individuals anyway, they haven't had x-rays in a long time, they've never had them, they have no history of neck pain, we would get the x-rays and that would show that's what's going on anyway. But that's something for you to try. That is called a cervical opener.